All right, we will go ahead and get started. I'm sure we'll have others joining as we move along. The chat is open for those that have questions throughout the session, and we will do our best to monitor and answer those questions during the towards the end of the event. But as we get started, we'll go ahead and get started now. So welcome. Thank you for joining us for our last patient roundtable of the year. My name is Maria Thacker Gothi. I'm CEO for the Center for Global Health Innovation and president of Georgia Bio. A key component of what we do at CGHI Georgia Bio is that we advocate at the state and capital and in Washington, D.C. on behalf of our members for policies and laws that will enable our sector to reach more patients more quickly with treatments and cures. Like most of the country, we're anxiously awaiting the December 9th runoff election to determine the results of the U.S. Senate race between incumbent Democrat Senator Raphael Warnock and Republican challenger Herschel Walker. While control of the Senate has been determined, the race for the seat in Georgia is still crucial, so we encourage everyone to exercise your right to vote in this important election in a few weeks. Now, before I hand the reins over to Dorothy, I would like to congratulate Grail for being honored in Time Magazine's Best Inventions of 2022 list. Their Gallery test, a multi-cancer early detection test designed to detect more than 50 types of cancers through one simple blood draw, is a game changer for patients. We're proud of all of our members and grateful to work with them. With that, I'm very excited for today's session. On a personal note, I myself am a cardiac patient at Piedmont Hospital and have had bypass surgery. So heart health is important to me on a very personal level, not just for my work every day and on behalf of patients. So that said, I'm pleased to turn things over to our fearless volunteer leader, Dorothy, to introduce the panel and get the program started. Dorothy.
Thank you, Maria. I appreciate all of you being here today and wanting to participate with us in talking about women and heart disease. It's an area that is overlooked, mostly because it is centered on men, although heart disease is the #1 cause of death in the United States. We want to bring attention, especially to the heightened risk of heart disease and strokes for our chronically ill population. We know that practitioners who are not skilled don't always diagnose fast enough, and that is a problem for patients in terms of getting the life-saving care that they need, particularly that the symptoms for heart disease and stroke and heart attacks for women are very different than they are for men. I personally was resting in my recliner when I had my first stroke. It was the last thing that was on my mind. Because it is different in women, we can experience more barriers to receiving the quick life-saving care that we need. We are fortunate today to have Dr. Jane Morgan, who is a personal hero of mine, and our dedicated panel to discuss heart attacks and stroke in women. Dr. Morgan is a cardiologist at Piedmont Hospital's Heart Institute, and recently, as she told us this morning, has a new position of Health and Community Director. She was also the clinical director of the COVID task force at Piedmont Healthcare. She is strong in developing an outreach connection with the Division of Diversity and Inclusion between Piedmont and the African American community that it serves. She has analyzed data on the disproportionately negative impact of COVID on minority communities. She serves as the president-elect of the Southeastern Life Sciences Association and the director of innovation at Piedmont Healthcare. I could go on and on to tell you all about the positions that she's had in her accolades, but I will say that Piedmont Heart Institute is a clinical destination for cardiovascular care and a leader in advancing innovative heart and vascular care for patients with even the most complex conditions. We thank you, Dr. Morgan, for joining us. As a woman. With all your accomplishments today, you inspire us. Our other panelist is Haley Stowe. She's a public health analyst at Million Hearts, the Division of Heart and Disease Stroke Prevention at the CDC. Haley is a health analyst for Million Hearts' national initiative to prevent 1 million heart attacks and strokes by 2027. She manages the Million Hearts Cardiac Rehabilitation Collaborative, a group of 500 individuals working to achieve 70% cardiac rehabilitation by 2027. Our other panelist is Tanya O'Brien. Tanya is a CDC worker. She's been in public health for over 20 years and works in empowering communities. But today she's here as a hypertensive patient and an advocate who was encouraged to do self-measured blood pressure monitoring, which led to a diagnosis that she needed to have treated. Murin Sharp is an accomplished executive who provides executive leadership to high-growth technology companies. She's a survivor of heart disease, open heart surgery, and a women heart champion who shares her compelling story on local and national levels. She has a great TED Talk that will be listed in your chat that you can go to. We're going to get started today with first having Haley share some important information about Million Hearts from the CDC. And we'll let Haley, would you like to present your slides now?
Wonderful. Thank you, Dorothy. Thank you for that introduction. Happy to be with you all this afternoon to talk about Million Hearts and opportunities to improve cardiovascular health of and with women. Just a quick disclaimer, the comments on my own do not necessarily reflect that of the CDC. So we don't have a hand raised, but there is a reaction button. If you would like to click the heart button to indicate if you know a woman who has had a heart attack or stroke. And it sounds like we've got quite a few with us in the group today. So there's a hand raise. Yes, I think many of us, maybe all of us, know a woman who has had a heart attack or stroke. It's very prevalent, which gets me to the leading causes of death. So for women, heart disease and stroke are the first and third leading causes of death in our country. Now, these are 2018 data. Right now, COVID is the third leading cause of death nationally, and those are preliminary data, but we do know that heart disease and stroke remain in the top 5, and for women, it's first and third. Is a big indicator in 2018. And unfortunately, there's a rise in mortality. So in darker red, you see where there's an increase in mortality and death rates of cardiovascular disease, and that's in the darker red region in the southern. So there's a geographic disparity as well to heart disease and stroke mortality. And as Dorothy mentioned, there's often a lack of knowledge about the symptoms. So some women have no symptoms. Others have other more traditional, what we think of symptoms for heart disease or heart attack rather, or stroke. And then other women have other symptoms that may not be as obvious, such as nausea, vomiting, and fatigue. Now, these data are a bit outdated as well as this 2016 data, but we do know that the heart disease and the stroke data are about similar. I'm going to walk you through this. The first column is the causes of death, and we know that heart disease is the leading cause of death in the country. The second column shows the number of Google searches on health-related topics. And you see heart disease, this giant little sliver, about 2% of all the Google searches were around heart disease. Vast amount on cancer was a big Google search topic. And the last two columns show the number of health indicated issues in the media. And again, heart disease, just the tiniest little sliver at the top, even though it's the leading cause of death. You do see stroke in the middle here as green as well. But overall, we've got a lot to do to bring heart disease up to being a top issue and something that's on mind of folks in our country. So how can we prevent heart attacks and strokes? Well, we know that we've done a lot of modeling at CDC about this, and blood pressure control is really the best way to prevent cardiovascular events. Overall, blood pressure control is a leading indicator of risk for having an event. And just as a reminder, blood pressure is the pressure of blood pushing against your arteries. It's very different than the heart rate or your pulse, for example. And it's often does fluctuate throughout the day, can rise and fall, but when it's continuously over a threshold and continuously high and pressing on your arteries, then we have a problem. And it's a bit exasperated. So how blood pressure is measured in our country, a lot of times people come in for a wellness visit, sometimes one time a year. The blood pressure measurement is not always the most accurate. So this figure here shows an inaccurate way to take blood pressure. The feet should be supported, the back should be supported, the arm should be supported. The patient looks concerned, so there should be a 5-minute wait before taking the blood pressure. And it looks like the clinician might be speaking, and obviously some other issues in the blurb at the bottom, just a high level of anxiety. So this is not the right way to take blood pressure, and can be a big problem in our country as far as getting accurate measurement. So the right way to do it, and what we know the evidence aligns with, is self-measured blood pressure monitoring, where the patient takes his or her own blood pressure sometimes at home, sometimes in other settings. And it's really the pattern of measurements that can be a huge indicator in knowing what blood pressure the patient has. And a recent paper was just coming out earlier this year in the Journal of Women's Health that shows hypertension can be better detected and controlled throughout the life course by supporting SMBP or self-measured blood pressure monitoring. It is effective, it's more convenient for patients, it's more accurate by far, and it can be very empowering as well for the patient's engagement in his or her health. These are the guidelines for hypertension thresholds. So we see about 130/80. So there's two measurements in the blood pressure control, the systolic and the diastolic. About 130/80 is the indicator of pre-hypertension or stage 1 hypertension, and 140/90, again, this is when the diagnosis is made by the clinician from that pattern of measurements. Ideally, 140/90 is hypertensive and perhaps in need of some treatment or lifestyle modification. So overall, we have a huge hypertension prevalence with hypertension control being very low. So about 1 in 2 of all adults in our country have hypertension. That's 116 million people. Here you see the data broken down by race and ethnicity, with non-Hispanic Black women having the highest percentage of hypertension, about 58% across the country. We know about 80% of these adults are recommended prescription medications with lifestyle modifications, and yet only about 25% or 1 in 4 adults in hypertension have it under control. So a lot of a big gap to meet 100% blood pressure control in our country. And again, we see disparities by race and ethnicity there. And uncontrolled hypertension, we know we spoke about its indications for heart disease and stroke. That's the heart attack, heart failure, stroke, but it's also a key factor in vision loss, pregnancy-related complications, the vascular health of your limbs with peripheral artery disease. It can lead to sexual dysfunction, predominantly in men, and kidney disease and failure, as well as cognitive decline. So really, uncontrolled hypertension has a vast more implications across the health of your body. The good news is we know what to do. So as Dorothy mentioned, Million Hearts is a national initiative that's led by CDC and the Centers for Medicare and Medicaid Services. We work across a 3-part strategy of building healthy communities. These are what we think of as more the public health approaches, optimizing care in the clinical settings by focusing on aspirin use, blood pressure control, cholesterol management, smoking cessation, and increasing use of cardiac rehabilitation. And then we have a focus on health equity across the bottom with some priority populations, one of which is the pregnant and postpartum women with hypertension. Now, our guidelines, which really amplify SMBP as a key strategy, are well aligned and amplified by the Surgeon General's call to action to control hypertension and to improve maternal health, and the recent White House blueprint on addressing maternal health. And we do have some new tools for Million Hearts. So these will be sent out to you after the fact, but we've got some training videos on how to take your blood pressure accurately. There's a validated device listing, and the last link here, choosing a home blood pressure monitor, shows all the different monitors with their different calibrations, different uses. It has an extra large cuff, and about 38% of all hypertensive women require an extra large cuff. So that can be a critical factor in getting an accurate measurement as well. It also has the cost of those cuffs in that document as well. So how are we engaging people in the public in heart disease and stroke? We've got 3 different campaigns that reach a more public facing. Live to the Beat is the one I'll speak to today on empowering Black adults to pursue heart health lifestyle. We have a new website, and it has some key features, not only on blood pressure control, but also lifestyle modification, how to exercise more, some opportunities to improve your health, all about taking small steps to get huge improvements in your heart health. And here's the slide with the QR code if you'd like to get it on your phone now, but we'll be sending this out after the fact as well, just an opportunity to engage. And there's a new opportunity now to even get this out further. So we have a live Live to the Beat campaign ambassador program where we're looking to engage trusted leaders, organizations, and Black-owned businesses across the country. And the opportunities to help share and amplify messages and resources, join in some fun contests. And the whole point is it's very upbeat, live to the beat. There's some very positive messages about engaging folks and then getting national recognition and prizes. And there's a whole variety of different swag that you can get with the Live to the Beat campaign. And if you know of organizations, or if you yourself want to become an ambassador, this is a link that will be put in the chat, but I'll also send out the slide deck. So overall, keep in mind blood pressure, ways that you can get engaged, making sure your blood pressure is taken accurately. You can talk to your prescribing clinician about your risk factors, checking your blood pressure and getting those measurements to your clinician. So it's not just about you taking the blood pressure, it's getting those measurements to your prescribing clinician and having a feedback loop in practice so that you know that medication is most appropriate and titrated appropriately. You can share some campaign resources, take the pulse check where you can do that on your own with the phone to see what kind of strategies might be most appropriate for you or to engage and improve your heart health, engage in our ambassadors program, or take other steps. And I welcome the opportunity to have a part of a discussion as we engage in a panel discussion. So thank you so much for your attention, and I'll pass it back to Dorothy.
Thank you, Haley. That was a fabulous presentation. There's a lot of information there in this short period of time. So I think everyone will welcome having the opportunity afterwards to go over the slides and take advantage of the great links that we have in that presentation. I'd like to now turn our attention to our entire panel and maybe go to Dr. Jane Morgan to talk to us a little bit about, as women, what are we missing about heart disease? How can we take care of our heart in a better way than what we have been doing?
So that was a really good presentation and overview from the CDC and from Haley Stolp. And so let me just add to that something that is generally not known and that we really need to uncover and highlight is the issue of pregnancy in women. Pregnancy is actually the very first stress test that a woman will ever undergo, and we need to think about it that way. This is actually a cardiac stress test, a volume overload, if you will. And so if during your pregnancy you have any complications of these words like preeclampsia, has anyone ever said that to you? Eclampsia, pregnancy-induced hypertension, or just high blood pressure, if you've heard that during your pregnancy, following the safe delivery of your baby, you absolutely need to follow up with the cardiologist. What we thought in the past was that the treatment for preeclampsia, the treatment for eclampsia, which is high blood pressure, but also impacting your kidneys and other organs of your system, the treatment was actually the delivery of the baby. Because once the baby is delivered, generally all of these symptoms disappear. And that was thought to be the end of that. But now we know that that actually is just the beginning. That heralds and gives us a clue that this is a patient that is likely going to move forward and have early or premature cardiac or cardiovascular or heart events. And so following the safe delivery of the baby, that really is not the end of the story. That has to be the beginning. And that woman must now be referred to a cardiologist for appropriate care and management because of her risk that has already been declared during that stress test, which we called a pregnancy, which she failed. So when you have a failed stress test, then you have to move forward with your cardiology consultation as you would any other stress test. And so when we look at this, especially with the increased rate of maternal mortality here in the United States, which is really just a catastrophe in a country where we're supposed to have the best medicine in the world, and we have the highest maternal mortality rate. We've got to take a better look at that. We need to understand what that means for all communities and who has access and who does not have access, and what that means with the management of your prenatal care as well. The last thing that I would say is, I think, which was very well covered, is that symptoms of heart disease in a woman could be different than that of a man. And it sometimes cannot be that dramatic presentation as we see maybe in the movies or on television or even in real life, where you have crushing chest pain, you're suddenly short of breath, or maybe you just collapse on the sidewalk. You know, all of these, absolutely, people recognize, oh my gosh, someone's in trouble. We have to get them to the emergency room. We've got to start CPR. As opposed to a woman may have increasing fatigue. Who's not tired? Who doesn't get more tired as we approach the holidays? We're overwhelmed or managing a lot of things. And so that can be overlooked because you can think of a million reasons why you might be getting more tired, or subtle symptoms like lower back pain. Do you think of back pain as heart disease, or just have you been working too much, or are you just getting older? Subtle symptoms, jaw pain, you might end up seeing a dentist. So these are all subtle symptoms. And the reason I bring it up is because although men still are more likely to have a heart attack and have a higher incidence of cardiovascular disease, it's women who have the highest risk of death with the very first incidence of a heart attack. And so we've got to understand what that means and why that is happening. And so I will just stop there. I appreciate the presentation of Haley Stope. I'll just add to it and happy to continue to discuss.
Thank you. Thank you so much, Dr. Morgan. You are so right. We don't think of pregnancy as our first stress test, but it is a complete strain on the body for women. And for most of us, that is sometimes where the warning signals come up. And also the fact that you brought up about the symptoms for women are so different than they are for men. And women tend to overlook their symptoms, where men immediately are gripped by the symptoms of a heart attack. And also for stroke for women, sometimes the symptoms can be more subtle before the stroke actually comes on, and then before the physician realizes that's what it is. Thank you so much. I want to go now on to Tanya. Tanya, I want you to tell us about your story and why you agreed to be on this panel today.
Absolutely. Thank you for having me. Looking back on it, I can honestly say that working in the area of heart disease and stroke prevention probably saved my life. That may sound a little dramatic, but it's my truth. Like, I've worked in this area for a couple of years now. So trust me when I say I've learned more about blood pressure, especially self-measured blood pressure or SMBP and cardiovascular disease from the work I've done than I have from any doctor's appointment. During one of the first meetings I attended when I started working in the area, our director mentioned that she had measured her blood pressure that morning. And then we had like just a candid conversation about SMBP and prioritizing self-care and living what we preach as public health practitioners, right? And so for me, I was like, well, who knew you were supposed to be measuring your blood pressure? Like, I just didn't know. Like, I've worked in public health for a really long time, but not in this area. So within the next couple of weeks, I had a conversation with a lot of my family members and found out that most were barely managing their hypertension. They were on medication for it. And at the same time, I was researching home blood pressure monitors, and I kind of went down a massive rabbit hole on WebMD. Let me be the first to tell you, rabbit hole was not a good idea for somebody that's like a slight hypochondriac. Moving on. As the home blood pressure, as soon as the home blood pressure monitor arrived, I took my blood pressure and it was high. So like, thinking about what I learned in working in heart disease and stroke prevention, like, I looked down, I realized like my feet were crossed. I just drank a cup of coffee. So like, considering all of that, I was like, I'm gonna wait till the next morning to see what it's like. And when I took my blood pressure the next morning, it was still high, not as high as the day before, but it was still high. So I called my doctor to make an appointment. It was initially set for like a week away or something. But when I shared my blood pressure readings, she wanted me to come in the next day. And by the end of the next day, I was like on 2 medications and committed to making some serious lifestyle changes. And at this point, I thought to myself, well, like, you know, if you could have done it by yourself, you would have already done it. And so since that was the case, I was like, well, I'm gonna go get a trainer and just see what happens, like, give it my best. And also thinking about, well, what am I gonna do about my hair? Because like, I think for Black women, that is a consideration in terms of what kind of workout you do and how often you work out, because taking care of your hair is a very serious and like, I would say labor intensive thing. So for the most part now, I just have my hair braided. And I hired a trainer the next day. And when I say small changes can yield big results, I've seen it in my life. Like I've been on this journey for almost a year. I'm more flexible. I work out about 5 days a week out of habit now. I do still have a trainer. I don't fight with my trainer as much. I have more energy. I sleep better. I eat better. I feel like my taste buds have changed. Foods that I used to love, I don't particularly care for anymore. And I'm happy to report that when I went to the doctor a couple of weeks ago, my blood pressure was in a healthy range. So all in all, I feel like working in this particular role has been instrumental in helping me improve professionally as well as personally. And I'm beyond grateful for that.
Thank you for that testimony, Tanya. That is fabulous. We're so proud of you. And now it's in a healthy range. I know how hard that is. And let me tell you, yes, my African-American girlfriends is the same thing. What are we going to do with our hair? We can't be working out the way you white girls do because, you know, we sweat and all, and that hair is just going to get frizzy, nappy. And what are we going to do? We're working, we have a job, we have to be able to maintain ourselves. But thank you so much for sharing this great, great story. I really appreciate it. And Murin, you have a great story for us. Will you please tell us a little bit about your experience with your own heart disease and heart journey?
Yes, I will. And as you mentioned, Dorothy, there's the YouTube link on the chat for my TED Talk, which I gave at TEDx Savannah several years ago. My heart journey either began in 2013 or probably really began much before that. I think we like to fool ourselves. We like to think that we're healthier than we really are. Well, in the fall of 2013, I ended up in the emergency room here in Savannah, Georgia, with, let's call it, heart palpitations. Turned out that I had a disease, an inherited disease called hypertrophic cardiomyopathy. And you throw an O in there, obstructive, because there was an obstruction in my left ventricle. We've got, 4 chambers of the heart. The left ventricle is super important because it pumps out oxygenated blood to the rest of the body. The wall of that ventricle, in my case, and with that disease, was thickened. So I didn't have a very efficient heart. So by the summer of 2014, I went up to the Mayo Clinic in Rochester, Minnesota, and I had a septal myectomy, which means kind of a plumbing job, cleaning out that particular left ventricle. Now, the disease doesn't go away, though, even though I will not have that problem anymore. The aftermath are you have to watch out for aneurysms and all kinds of other things. That is a disease that affects 1 out of 500 people. And it's the disease that you read about in the newspapers, unfortunately, when an athlete, a healthy young man or woman, suddenly dies on the playing field or the practice field. And it's because, in fact, they had the thickened left ventricle and was undiagnosed. And in their case, their heart was pumping so hard that they ended up basically in heart failure, and many people die, young people, unfortunately. So when I was at Mayo, I made it my business to meet Dr. Sharon Hayes, who is the original director of the Women's Heart Clinic at Mayo. And she told me about Women Heart. What is Women Heart? And she said, Miriam, you should think about Women Heart. You need to give yourself a little time to recover. But up here at the Mayo Clinic, every October, we train Women Heart champions. I am one among 900 women who are in our communities as Women Heart Champions. A year after my surgery, I went back to the Mayo Clinic for the training. They very generously work with Women Heart to support the training, and came back to the Savannah community and founded our support network. And now I have 3 other Women Heart Champions here in Savannah. What do? We provide support network meetings. We visit women in the hospital after heart attacks or surgeries. And we give them what's called a red bag of courage, which is filled with great information about women's heart health. There are over 43 million American women who are either at risk or have heart disease. So our work is never done, so to speak. My heart journey, I mentioned that sometimes we deceive ourselves. As I look back prior to 2013, there were times when I would feel faint at a party or something like that. And I'd say, oh, I shouldn't have had that second glass of wine. Well, no, my heart wasn't really supporting me well. And also I had very unusual women's symptoms, back pain, indigestion. I didn't have what's called the classic Hollywood heart attack that we associate with men, grasping the left chest and so on. And I don't want to go back and recover a lot of the fabulous information that's already come out, but in a phrase at Women Heart, we say, women are not just small men. We are very different. And it wasn't until recently that under the guidance of Nanette Wenger of Emory University and Grady Hospital, that research for heart disease included women in the clinical trials. And I am very blessed right now because by great coincidence in my professional life, I am working as the interim chief marketing officer for a company that recruits patients for clinical trials with an eye toward the diversity that's necessary going ahead for clinical trials about medicine, devices, or any other kind of treatments for cardiology patients. Must include women. Thank you for this opportunity.
Thank you, Miriam. Thank you for that wonderful talk. And I do encourage everyone to please see her TED Talk. I'm going to come back to you with one question later, but right now I'd like to just, Tanya, tell us a little bit. You mentioned about your family and how they weren't monitoring their blood pressure very well. If you had to tell them one tip that you have learned from your own experience about this, what would you tell them to be doing?
I think, honestly, the first thing is to get a device. Like when I talked to them, none of them actually had one. Like they will go to like a CVS or a Walgreens or something and like go to the pharmacy area and get it measured there. I think that would be the first thing to do. And then 2, I feel like one of the biggest things that's helped me is having an accountability partner. Now, at this point, it's my trainer, but that doesn't mean that they have to go out and get a trainer. Like it could be, honestly, it could be me. I could be one of the accountability partners. But having an accountability partner, I feel like helps people in places where they can't do it themselves, or there's like something lacking.
Right, that support is really so important in dealing with any chronic illness. Having that support and a buddy that will check on you and that you can tell them how you're doing. That is a great tip. Murin, what would you say as something that we need to be paying more attention to and that we can impart to other women to help them?
Yes, right at the top of my list is if you feel that you were experiencing symptoms of a heart attack, and again, this broad range that includes women's symptoms, call 911, or if you're at home, have a loved one with you, have them call 911. Do not drive yourself. do not ask a neighbor or a friend or a relative to drive you, because you need to get into that van and they can start monitoring and communicating with a hospital right away. That is number one.
That's a great tip. And Dr. Morgan, you know, our audience is a very large patient advocacy community who works with disease-centered patients, so chronically ill patients. Is there any tips that we know that people who have autoimmune and inflammatory diseases are much higher risk at heart attack, especially for women, and stroke. Is there any tips that you can give us to this community to help us be a little bit more aware about our heart health?
So simple things to remember. Vaccination, flu vaccination. We know that influenza, or the flu as we know it, if you contract the flu, your risk of having a cardiac event or heart attack increases by 6 times in the first week to 10 days of you contracting the flu. Why would we put ourselves at that risk? Get a flu shot and decrease your risk of any type of heart event. This actually goes higher if you have underlying cardiovascular disease, whether you are aware of it or not. And so simple vaccination is a really easy public health tool that you can use to keep yourself and your family healthy from respiratory diseases and morbidity, meaning just illness at home. Don't forget, just because you're not admitted to the hospital doesn't mean you're not at home and miserably ill and missing out on work and missing out on your family time. You can be quite sick, but not in the hospital with these respiratory viruses. But the other thing to remember, and maybe that you don't know, is that it also increases your risk of heart disease, and even more so if you have underlying cardiovascular disease. So think about that with these flu vaccines. COVID vaccines as well. COVID increases your risk of myocarditis, or an inflammation of the heart. We see a lot of that hype talking about rabbit holes, talking about social media rabbit holes. We've seen a lot of that down in rabbit holes, claiming the vaccines cause myocarditis. While that is also true, it is in a small number of people, and in comparison to what the actual virus causes, there really is no comparison. COVID, the SARS-CoV-2 virus, increases your risk of myocarditis more so than the vaccines. Simple measures that you may not be aware of. Actually, caffeine seems to not be harmful to the heart, and actually might be somewhat cardioprotective. So have that cup of coffee, if you will. Good sleep, as we all know, that's pretty intuitive. Most of us don't get it. Last night, I finished my work at 11 p.m. Somehow I still didn't get into the bed until 1 a.m. I actually don't know what happened to those 2 hours. You're probably like me. I don't know how it went from 11 p.m. to 1 a.m., but there you are. So we've got to be able to get sleep. I try to practice, what I preach. And then the last thing that I will say is we talk about different communities. The Asian American community, we have seen their risk of heart disease increase dramatically just between 2007 and 2018. There's a paper out just recently published about that. And we have to remember that the Asian American community, rapidly growing demographic here in the United States, they are also very heterogeneous, not all the same. We have to be careful and not lump them all together. That being said, as a group, we saw their rate of heart disease increase, not inconsequentially, in the past decade. Now, the exceptions were the Japanese, the Pacific Islanders, and the Hawaiians. We don't know the answer to that, right? This is a very mixed group of people, but we do know that many of the Asian American diets, traditional diets, are high in sodium. So that is one postulation. The African American population, very well known, all types of socioeconomic challenges, discrimination, racism, access to health care, inappropriate medical care, trust issues, access to medications, the ability to afford medications, and on and on and on. And so we see this prevalence in these communities as well. We have to remember that we are all interconnected. We are all here together. A healthy society makes all of us more productive and moves all of America forward. And so these are just maybe some tips that I can think of that we can perhaps easily incorporate as we move forward into the holiday season. Get your flu shots, get your COVID shots. Even if you don't think that it is necessarily to protect you from respiratory viruses, it may actually save your life from a cardiovascular event.
Thank you. That is so important, and something we don't mention enough is the importance of vaccines, which is really for us as women should be just maintenance care for us. We should be staying on top of that and being very aware and telling our other female friends, tell your sisters to do this also. Get your vaccines and just be more aware of what the signs that your body is telling you to prevent cardiovascular disease. Haley, I'm going to start with you, a little lightning round before we wrap up. Give us the pearl of wisdom that you want this audience to know about Million Hearts and why it's important.
Thanks, Dorothy. Yeah, so blood pressure is key. Really take that blood pressure with consideration and care, really. Automatic blood pressure monitors are available. Tanya, to your point about pharmacies and grocery stores, those kiosks, evidence has shown time and time again, those are the worst measurements of blood pressure, unfortunately. But even 37 state Medicaid programs do cover devices now, and many payers do, and sometimes it takes an enrollment in a chronic care program or a case management program, but those devices are available a lot of times through insurers. Otherwise, you can purchase your own through other means. I really appreciate Dr. Morgan's comments on the flu vaccine. Yes, very much so. We're also seeing particulate matter has a big indication on heart attack and stroke risk. So exposure to particulate matters, 2.5 micrometers can be a key factor also in heart disease and stroke. But overall, I encourage everyone to go to the Million Hearts website. It is largely geared towards clinicians and public health professionals, but I highlight some of the tools in my slides and happy to engage on social media as well. It's a great way to stay involved and be connected as new messaging comes out and opportunities to engage in our really exciting and dynamic campaigns with Live to the Beat.
Thank you. Murin, tell us a pearl of wisdom from your own experience and what you know about heart disease.
Yes, take care of yourself first, ladies. We women try to take care of everybody else around us, but if you're not healthy, if you don't survive, then you can't take care of your children, grandchildren, elderly parents, and so on. And whether it's monitoring blood pressure, as Haley recommends, and Tanya gave very practical information about that, taking the time to have your checkups and getting your immunizations, as Dr. Morgan said, you have to be healthy first before you can take care of other people. So that's it. Be selfish, I guess, for good reasons.
Great advice. Great advice. Tanya, do you have a pearl of wisdom to leave us with today? You've given us so many already, girl.
I really just reiterating what other people have said. Like, you have to take care of yourself first. There is no way around not doing it, and nobody can do it for you.
Great. Thank you so much. Thank you very much. Dr. Morgan, do you want to close us out with anything else? Tell us, do you think the future of preventing heart disease and strokes in women is bright?
One of the things that we need to move forward with, and I appreciate that question, and I know Miriam touched on it, is we have to begin to push to have representation of women in clinical trials, very specifically as well, postmenopausal women. But we also saw in these COVID trials, and I have spoken openly about this, is that we included women in the trials, but we forgot to gather data on all types of hormonal symptoms. And so did we have any menstrual data on the vaccines? We did not.
Yes.
We started to hear about things after the vaccines were available. And oh my gosh, we developed the trials and we included women because we're so forward thinking. We forgot that women weren't men. And we didn't include any extra data that we were gathering on women. And so we had to scramble and go backwards. And so we absolutely want to make certain, and we actually by and large have done a better job of including women in trials. We need to look at postmenopausal women, but we also need to think about all other communities, the African-American community in particular, with so many atrocities committed against this group in the name of research and science and medicine moving forward based on the sacrifices and deaths oftentimes of people being in research or being used for research. And that has really stigmatized medicine very deeply. It's very deeply entrenched within the community. We've got to begin to move this community, of which I am a part, away from exploitation towards representation. And that's going to take people like myself and all of you being advocates and teaching what it means to be included in these clinical trials. And literally there has been no further information that has come to the African-American community since the late 60s and 70s when the Tuskegee experiment ended. That was the last we ever heard about clinical trials. So that's a long time. That's 2 or 3 generations went by. Nobody ever provided any other information. So this is a tough boulder to push uphill, but I am pushing it. I encourage everybody to push it with me. We need all representation of peoples in these trials.
Thank you. Thank you so much, Dr. Morgan. And we are with you 100%. We talk a lot about inclusion in clinical trials here at Georgia Bio. It's one of the things that we always touch upon and that we always have speakers on because we realize the importance of that. I just want to thank everyone today for just taking the time to be on this panel, sharing your words of wisdom with all of us. Ladies, we need to talk more about heart disease and stroke and how it affects women. You need to talk to your friends and your girlfriends about this because we don't communicate about this topic enough. We tend to keep it hidden until something happens, and then we're all very surprised. So our communications have to improve with that. And maybe that's something that we could talk more to Million Hearts about. And Murin, who's a communications expert, about how do we communicate better to other women about the risks of heart disease and stroke and how it has to be a part of their well-being when they look at their whole wellness plan. Thank you so much. I hope you enjoyed us talking about this today. It is a topic that has been important to all of us and that we need to take heart disease and stroke very seriously. Thank you for my dear panel, and I appreciate every single one of you. You're all heroes to me. Thank you.
Thank you for having me.
Thank you.
Thank
Bye.
you.
Thank you.